Do you think yoga influences cancer therapy? And does it make an impact when combined with cancer therapy?
Yoga, the root word of yoga comes
Mhm.
from the Sanskrit phrase called yujjate anena iti yoga, literally translated as whatever you yoke things together. Yujjate comes from the word yoking things, so you connect one with the other,
Mhm.
right? So what are we connecting? In essence, when it was originally created, we are connecting the body with the breath, the
Okay.
breath with the mind, and finally letting go of the body, letting go of the breath, focusing on the mind. So it's been a tool to control the mind.
So when you talk about spiritual peace, or when you talk about yoga and meditation, there's always a religious affiliation which is attached.
Yeah. More of a
Yeah, you're
lifestyle.
chanting ah, you're chanting ooh, you're chanting Isn't the whole problem comes when you're trying to put it together and call it om and trying to put my hands together and pray to some almighty and divine and get some blessings and etc., which is a mechanism, which is a religious mechanism inbuilt for everybody in every religion.
Welcome to OncoFlix podcast. Inner peace and yoga. It isn't liked by cancers, and probably we could see better responses in cancer therapy. Today we have with us our special guest, Dr. Amruthanshu Ram, head of the Department Yoga Sciences at HCG Hospitals. Welcome, Dr. Amrit. Thanks for
Thank
coming
you.
on our show.
Welcome, sir.
Thank you.
So, do you think yoga influences cancer therapy? And does it make an impact when combined with cancer therapy?
It definitely does. Um, so there was a very early finding, almost 3-4 decades ago,
Mhm.
where they tried to look at groups of patients who were depressed and who approached this entire diagnosis and treatment of cancer with an outlook that it is terminal, with an outlook that it is difficult, with an outlook that it is very stressful, and as opposed to another group of individuals who approached it as a challenge, who approached it as something that is another fight in their life, that is another thing that they need to encounter.
Mhm.
And on a long term follow up, and this was a data published 40 years ago,
Mhm.
on a long term follow up, we noticed that the researchers noticed that the disease free survival, mortality rates, and all of this was much poorer in the group that did not take this entire challenge in the right spirit. So
Mhm.
it was one of the first research papers that talked about the value of mind
Mhm.
influencing disease and influencing treatment outcomes.
Mhm.
And 40 years we've evolved into multiple evidences that has a very clear cut statement across that a majority of the activity that you do is driven by your attitude
Okay.
and is driven by your emotions, is driven by your perception, and thereby how you perceive stress, how you cope with it, and how you interact and deal with it.
How would you describe the synergism between yoga and meditation? And generally, it is believed that people who practice either of this, even the general population, are believed to be healthier than the ones who don't.
That's a very interesting question. Yoga, the root word of yoga comes
Mhm.
from the Sanskrit phrase called yujjate anena iti yoga,
Mhm.
literally translated as whatever you yoke things together. Yujjate comes from the word yoking things, so you connect one with the other,
Mhm.
right? So what are we connecting? In essence, when it was originally created, we are connecting the body with the breath, the breath with the mind, and finally letting go of the body, letting go of the breath, focusing on the mind. So it's been a tool to control the mind, yoga. And so yoga and meditation is not two different things. Yoga and yoga asanas are not two different things. Yoga and pranayama are not two different things. Meditation, pranayama, asanas are all part of yoga.
Okay.
And combining, integrating all of that
Mhm.
is the way to kind of approach yoga and try and see how we can leverage the physical body, the breathing, the awareness, and focus it on a positive attitude.
That's very interesting.
Very interesting. So I didn't know that yoga and meditation are the same. So that's a very interesting perspective. So does yoga for a normal person reduce the risk of cancer?
Yes. So we talk about positive lifestyle activities, right? And nowadays we understand enough about the immune system. We About a decade ago we understood enough about the endocrine system, and we understood that there is an internal ability to fix ourselves, right? All we need to do is to potentiate that. And any positive practices, so this was a discovery that happened again about a decade ago, maybe a little more than a decade ago, where any positive practices, whether it be good diet, whether it be good physical activity, whether it be good stress, coping with stress, any positive. So even if I go for a walk in the morning and I stick by that, if I have good diet or if I have timely food, any positive lifestyle activity contributes to reduction in non-communicable diseases, and by virtue of, by extension, cancer as well.
So, what exactly happens inside our body when we practice this yoga or meditation or relaxation techniques?
Mechanism of action of yoga is a very interesting idea. There have been some researchers who have kind of explored some mechanistic networks as to try to understand the physiology that changes with yoga. um, People working earlier on stress, right, understood very clearly that the HPA axis is impacted.
For the public,
So the hypothalamic pituitary adrenal axis, where the hypothalamus and the pituitary, which are the master regulators of the endocrine system, kind of give out signals and create an environment of stress in the body. And they are the same ones that are responsible for creating a environment of stress reduction in the body. So you can use the same ability to fight or flight or correct that response through yoga. And this is the HPA axis. Now we understand that the HPO axis works for the hypothalamic pituitary ovarian axis, works for situations like PCOS, etc., for related infertility related gynec issues that are there. In cancer, what we are understanding most recently is the PNI axis, or the psychoneuroimmune axis, which is the understand the how the psyche or how the cortical regions of the brain perceive the environment around us, and that creates a nervous drill down into creating a situation of chronic inflammation. And whether it be metabolic imbalance, whether it be immune dysfunction, this chronic baseline shift that is happening to be at a higher level of normal is what is causing chronic inflammation, chronic imbalance, insulin resistance, all of these problems that are impacting NCDs. And we understand today that the milieu, the immune profile of the human body is what allows cancers to develop. And that is why immunotherapies are coming up to make it more detectable. And we help that situation by doing yoga, where we try and reduce the chronic inflammatory milieu of the body.
Right. So it has multiple positive effects.
Yes.
It's very, very interesting. So, with respect to cancer patients, they undergo a lot of fatigue during, the traditional treatments such as chemotherapy, radiation, or surgery, for example. There's a lot of pain aspects. There's fatigue. There's anxiety as well when you hear the word cancer. How does yoga help in these conditions? Pain, anxiety, fatigue, and
So one of the sorry.
yeah, how do you sequence your yogic techniques in creating an impact for quality of life of patients?
So one of the very important baseline requirements for us to integrate with oncologists at especially like a place like HCG Hospital has essentially been to not overpromise what we are claiming to do with yoga. Right? That gives both the patients as well as the oncologists the kind of trust to allow patients to also do yoga. Secondly, yoga itself is not specifically predefined set of practices, right? I can walk, but if I build in a sense of awareness, it becomes a yoga, right? It becomes yoga. I can stretch, I can do my counts like how I do in the gym, but if I build a sense of awareness, then it becomes the same exercise becomes yoga.
Okay.
So what we do with patients is exactly this. So whatever they are already used to doing with regard to physical activity, we use the same thing but help build the awareness as part of these sessions. One of the most common side effects of cancer treatment is nausea, vomiting as a result of chemotherapy, is a lot of burning sensation as a result of radiotherapy, and wound healing and lymphedema and etc. as a result of surgery. So over the past probably 2 decades at HCG, the founders of HCG have been very, very supportive of this entire integrative model, where they brought in yoga experts, they brought in yoga researchers to collect very stringent data, and we've been able to do several randomized controlled trials in the field of yoga for at different phases of cancer treatment.
That's wonderful.
And most of the time we see that there are psychological benefits, anxiety and stress and depression and all of this reduces with yoga, but majority of the time there is a lot of symptomatological benefit improvement also, where nausea, vomiting. So one of the most landmark studies we had done showed that the anemia related treatment discontinuation that happens during chemotherapy is alleviated through yoga, because the nausea, vomiting is reduced. The anticipatory nausea is reduced because of yoga. Well. So they're able to eat, maintain their nutrition, and therefore don't succumb to anemia.
Much better.
Right. So when we talk of cancer, we often call it as a state of immunosuppression or immune dysfunction. How does this body mind techniques influence the immune system in a positive way?
So in yoga texts, in fact, Sage Patanjali, he talks about the ways in which the mind can get confused. There's a very interesting analogy. It is an analogy. He didn't talk about the example that I'm going to give, but the idea is when the immune system recognizes one's own self as foreign, right? That is a way in which the body gets confused,
Correct.
and that causes autoimmune disorders.
Right.
Whereas another way of confusion is that there is something bad that is happening in the body, something that is violent, that is growing in the body, but the immune system is not able to detect it. So that is another way of confusion that is there. So these are two ways in which the body gets confused, the mind gets confused, and therefore results in disease. So not directly targeting this, but positive affirmation, right? Focus and positive affirmation coming from a deep sense of relaxation and silence, right? In yoga, we have a beautiful phrase which is called wakeful rest, right? We usually associate wakefulness with being active, whereas sleep and being unconscious or at the time of sleeping as being resting. Whereas yoga is a situation where we are at a phase of wakeful rest, and that wakeful rest phase has a lot of healing potential. And at that point of wakeful rest, we are able to provide patients with a positive affirmation saying that I'm going to fight this, I'm going to get healthier, I'm going to have fewer side effects, I'm going to beat this thing, and I'm going to be more positive and have a better outlook. And that positive affirmation helps to a very, very great deal to bring about these physiological transformations eventually.
Very
Positive
interesting.
biofeedback.
So, are there any clinical trials which have been done in your institute where there is a combination of manipulating the microenvironment, or in combination with immunotherapy, wherein the effects could be enhanced, where yoga could be used as an enhancer to immunotherapy? Because you're talking about pituitary immune axis. So, are there any clinical trials which you've been doing or planning to do in the future?
So yeah, we do plan to do a few clinical trials relating to immunotherapy specifically. But in the past, we have seen a very interesting effect. We looked at 3 groups of breast cancer survivors who have finished treatment more than 5 years ago.
Okay.
These 3 groups, there were there was one group of breast cancer survivors, one group of normal, healthy women, age matched, without any comorbidities, who have never practiced yoga at all in their life, and another group of women who are again age matched, who have been long term practitioners of yoga. And the first group of breast cancer, the second group are normal, healthy people who don't do any positive lifestyle activities. The third group are those that do positive lifestyle activities. The health spectrum from illness to health to well being, right? When we looked at the immune function of these patients, we looked at two very important parameters. We looked at apoptotic index, which indicates the ability for the body to destroy disruptive cells. And we looked at something called as the DNA damage, right, which is a way of understanding how much cellular damage there is in the body. So if I have to look at a balance between DNA damage and apoptosis is the way the body heals itself. DNA damage is the way in which the body succumbs to damage. We noticed that in breast cancer survivors, the DNA damage was very high. The apoptotic index was reaching up towards that. In normal healthy individuals, the apoptotic index was higher than the amount of DNA damage that was there. What we anticipated was that there would be very low DNA damage and very high apoptotic index in people, normal healthy women who do a lot of positive this one. To our surprise, we found that because there wasn't any DNA damage, the apoptotic index also was equally low. So the requirement for fixing an issue is not there when there is no issue to fix. So you have the ability of the body to keep healthy is much better. Another study that we did was looking at the cytokine profile of individuals. We divided 6 cytokines that are responsible for creating creating a pro-inflammatory milieu in the body. 6 cytokines that were anti-inflammatory, and balanced those two between groups that did do yoga and groups that didn't do yoga and breast cancer survivors. We noticed that in breast cancer survivors that did yoga during their treatment, right, had much better anti-inflammatory activity and much lower pro-inflammatory activity, indicating that. So as oncologists, what do you tell the patients after you finish your treatment? That now you need to focus on lifestyle, you need to stay active, you need to keep a good diet, keep your inflammation low, right? And that is going to prevent recurrence and etc. And this we actually showed with regard to pro and anti-inflammatory cytokine status.
Excellent.
Great. That's wonderful.
So when you talk about microenvironment, we also say about T cells and dendritic cells or NK cells. These are absolutely important cells to probably prevent the disease from coming back. Are there any studies in the yoga or international studies where yoga has proved that when you do yoga, there's going to be more amount of T cells, dendritic cells, or NK cells?
So the natural killer cells was one study that was done. In fact, that was an award paper at ASCO about 10 years ago, and where they showed that the natural killer cell count increases when you do yoga.
Wow.
And we didn't look at it from a microenvironment perspective, from where the tumor is localized to, but peripheral blood, we showed the natural killer counts increase. There was a subsequent study that we are also currently engaged in, where we are looking at the specific activity of natural killer cells, whether that gets potentiated also through yoga.
So this was cancer patients.
This was in cancer
patients.
Yes,
It was
yes.
not general population.
Yes, cancer patients.
It's very interesting. So just like how there are styles of dance, are there styles of yoga? Is there a specific style that has been well studied in this cancer population?
So there are some styles of yoga which have more publications than the other. First, the most common one is something called as mindfulness-based stress reduction. So the MBSR is a Tibetan form of yoga, and that has many publications to its name. Something similar to cognitive behavioral therapy, there is also some studies around using CBT. What we do at our organization is to try and look at what practices might have helped the most, and we call our style of yoga, if you want to use that term, as integrative yoga, right? Integrative yoga therapy. and where we try and integrate the best practices from different schools.
Right.
Because there are asana heavy schools, there are stretch heavy schools, there are breathing heavy schools, there are meditation heavy schools, and we try to want to bring the best of all these activities together to build that momentum of building awareness.
Right. Right. And is there a specific style that has been well studied in oncology, or is it this?
So most of the studies, in fact, HCG has the highest number of publications as a single institution
Yes.
with regard to randomized controlled trials in yoga and oncology. And all these, and thanks to this, in oncology, the integrative yoga therapy module is probably the most published as a result of that.
Integrative one. That's interesting.
So sleep quality plays a very important role, especially the circadian rhythm. We've seen in many of our studies that when we give chemotherapy at a certain time, the effectiveness of chemotherapy is significant. I'm sure meditation plays a very significant role in enhancing sleep quality. What are your thoughts on the same?
So generally, insomnia or quality of sleep refers to the period that it takes from getting into bed to reaching that first cycle of REM, right? The deep sleep phase that is there. So as long as we are able to shorten that phase, that means we are able to hit the bed and fall asleep much faster. And the reason this doesn't happen, and this is not a study that is done in cancer patients, but the reason that this doesn't happen is because the mind is active, right? And the mind is not willing to shut down. And so what we generally assume is that meditation is going to help sleep. Actually, it's the other way around. Right? If I'm going to catch a moving bus, first I need to be able to get at that same pace and then hop in.
Correct.
Right? So this is a study that has been done in insomnia patients where I do physical activities if I'm not able to fall asleep. Then combine that physical activity with breath. Let go of the physical activity and just hold on to the breath. Get into bed and continue the breathing until I fall asleep. They have shown very, very good results where they're able to bring about that deep sleep at a much, much faster rate. We also see that the quantity of sleep is not as important as the quality of sleep. Right? And the longer I'm able to stay in that deep sleep state, the more rested my body feels. And this was shown again in an insomnia study. The literature is available, where they showed that the cortisol slope, starting from a high cortisol in the morning to a low cortisol in the evening, that cortisol slope restored its slope or became a higher gradient when people started doing yoga and had more rested sleep. So interestingly, in that study, they didn't show increase in the length of sleep, but the increase in the quality of sleep. And this is very specifically the reason why, and you mentioned that the time at which we give chemotherapy is very important. At HCG Hospital, we ensure that we try and talk to the patients while they are undergoing chemotherapy, so that for that 2-3 hours that they are receiving chemotherapy, they are able to do simple breathing practices, simple toe based movements, simple hand fingers based movements, right? The other hand that is not receiving chemotherapy, they can use to do very simple practices coordinated with breath, building awareness, so that by the time their chemo cycle is finishing, they build that positive affirmation, say that, okay, this is the cycle that where I have fewer side effects than last time, or this is the cycle where I'm going to now heal better. And this kind of positive affirmation towards the end, before they get discharged, is actually very helpful for the patients.
It's interesting. So, talking of yoga and stress, we know that cancer patients undergo a lot of stress, and stress itself has a lot of mechanisms in which it can be detrimental to the cancer therapy, mainly because of cortisol and the whole axis, how it disrupts the immune system and the metabolic pathways also. Would you say that yoga can be a single stop solution to handle stress in cancer patients, or would you want to augment it with other methods?
In the truest sense of yoga right now today in medical field, what doctors are talking about, what health experts are talking about, what wellness people are talking about is integration, right? And we talk about integrative oncology more and more, right? So in the truest sense of being a yoga therapist, I wouldn't want to say that yoga alone can help, right?
Mhm.
There has to be integration. There has to be integration with the requirements of the patient with regard to nutrition.
Mhm.
There has to be interventions relating to psychiatry and psychology if
Yes.
required. There has to be integration with speech and swallow issues if they are facing any. There has to be integration with strengthening and building muscle and etc. with regard to their physiotherapy. So there has to be integration. If the patient is in pain, if the patient is in too much pain,
Mhm.
and I ask them to sit and breathe, they are not
Yeah,
going to
exactly.
focus on the breathing, right? If you or I have a toothache, all we think about the entire day is that toothache, right?
Yes.
Nothing else comes to mind.
Mhm.
So in that way, there has to be pain and palliation also part of this entire integration process. So in HCG, we have a very beautiful mechanism of yoga, of onco rehabilitation,
Mm.
where a group of experts from different modalities come together, sit together, and discuss what are the issues that are faced by the patient with regard to side effects, with regard to sequelae of treatment, sequelae of the disease itself, and thereby what are their contributions that can happen together, right, along with yoga. And I think that is the way that we can add value to bring about that
Mhm.
idea of integrated precision oncology.
So, when we talk of pain, since you brought that in, so there are different reasons why a pain can happen in a cancer patient. There could be a tumor sitting there compressing a major structure that is responsible for that pain, in which case a directed therapy there could relieve the pain. And more often, we find that psychologically being affected makes them perceive pain higher, right? So it's not that they are exaggerating it, they actually feel the pain higher because they are depressed.
Sure.
So, with each of this scenario, right, there is a physical lesion causing pain and there is a psychological reason increasing the pain. How does yoga help?
There have been some studies that have shown the effect of sound
Mhm.
in managing pain, right? So there are a lot of
Music.
simple sound that you can produce, right? So we help. So most common sound we use in yoga is Om chanting.
Okay.
So when
Okay.
you do Om chanting, you focus the vibration, focus on the vibrations that are created in your larynx. Focus on the vibrations that are created in your mouth, because when you close your mouth and do the part of the this one, if they are not comfortable with chanting Om, we break it up. We just do a lot of Ah chanting, Oo chanting. That helps a lot with understanding vibration, and vibration, focusing on the vibration kind of moves you away from that, the placebo, it creates a placebo effect from your awareness of pain. And it has been published in several articles relating to yoga.
Interesting.
So, can you say yoga is equal to spiritual well-being? And does that impact outcomes, survival, recurrence rates, metastatic, scenarios?
Very interesting question. Uh, we do attach yoga with spiritual well-being. However, um, we have figured out how to measure IQ,
Mhm.
right? Intelligence quotient.
Mhm.
We have figured out so how to measure emotional quotient, right? There are questionnaires that are there to measure emotional quotient, not very standardized.
Mhm.
Today, we don't have a scale that is standardized to measure spiritual quotient.
Mhm.
So, yes, we don't have a way to directly answer your question with available literature that is there. However, just last month in April, there was a meta analysis that was done to understand if spiritual quotient in fact impacts um, cancer survival and recurrence free
Survival.
survival and etc. And they found that there was a very mild effect that it had. The paper also concludes that the reason why they could not attach spiritual wellness with survival rates was because of the non-standardized way we are measuring currently spiritual wellness. And I think that goes to show that it's not disconnected. I wouldn't say that spirituality and yoga are disconnected from each other. They're definitely connected with each other, but we don't have a objective
objective way of
way to
measuring.
measure it yet.
So, when we talk of evidence in cancer, it is always randomized clinical trials where one group receives an intervention and another group doesn't receive that, and you find the difference. We know that HCG and you have been pioneers in publishing results with respect to yoga and randomized trials. So, where does India stand with respect to yoga in randomized clinical trials? Has there been studies across the world with respect to this?
So, yeah, there have been studies across the world. In fact, one of our first collaborations was with MD Anderson Cancer Center, where we looked at breast cancer patients who are undergoing chemotherapy and looked at their quality of life measures. It was most recently we concluded a study on hematological malignancies, where we again wanted to look at psychometric parameters like quality of life, anxiety, depression, etc. The analysis of which will start soon and subsequently get published. There are randomized controlled trials happening in many places like UCLA, Rochester University, I think a few other places. By far, I think we in India has been at the forefront in creating yoga related RCTs. So if you look at the amount of literature there is in randomized controlled trials, there are many organizations of India have been at it for almost a decade now. In fact, there is a clinical practice guideline on yoga and oncology, yoga for oncology, that got recently published last year, late last year. It has come through the NIH system. It is advised for oncologists to study it right now as part of their oncology training as well.
Interesting. So you spoke about, yoga and meditation having different schools with different methodologies. If a patient taking chemotherapy just sits, inhales, just watches their breath slowly, inhale, exhale, does it mean meditation and yoga? Or do you think that also is kind of a relaxing kind of a methodology for patients?
Aji upaya, right? So if you wanted a home remedy, if you wanted to know how to solve anything in the early days, the easiest thing would be to ask Aji, right? And she has the answers for everything. And
So that is a grandmother.
it's the grandmother.
Grand.
So she would, and what was her remedy? Sit, relax, take a deep breath, and observe your breath, and then try and understand the problem, try and address the issue. I'm sure you will do this for patients who feel anxious in your OPD as well, right? Where you say, take a breath, right? It's okay, relax, take 5 seconds, take a couple of deep breaths. This is all yoga, right? This is all part of yoga itself. What are we doing? We are trying to attach a physical activity with awareness, right? What is happening? They are thinking about the future. They are thinking about why me. They are thinking about why did this happen to me, right? They are thinking about their pain. They are thinking about their cost. They are thinking about 100 different things,
And that
right?
influences the
And that influences the hormones, the immune system, and creates a whole cascade of issues. So as doctors, you already practice yoga, right? You tell the patients, take a deep breath, sit quiet, think about things. Then I will give you the reassurance of what we can do, what we could do, how it could impact, how we can deal with it, and all of that. We just extend it a little more into a formal session where they know they are going to be doing this.
Excellent.
So, when we talk of adherence, once you teach a patient, how easy or difficult is it for them to follow what you're saying? And do they always follow that?
Yes and no, right? So adherence is definitely an issue. One of the studies we did in head and neck cancers, I think in 2016, we found that 70% of the patients who do yoga in any form, right, don't tell their doctors that they are doing yoga. right? Because of various different reasons, right? Some of them felt it is irrelevant, right? My yoga is my activity. It has nothing to do with what the oncologist needs to know, right?
And we may not be asking
Correct.
for it also.
You might not be asking for it also. Again, that was the next data point. 75% of oncologists never inquired about any positive lifestyle
Right,
practices.
very true. So,
Right?
as much as we ask about diabetes, hypertension,
Exactly.
smoking, alcoholism, we never inquire about their exercise habits, their
Exactly.
dietary habits, or the positive changes like you
Exactly.
mentioned.
So there are a lot of barriers around this. One is the idea that these two aren't apparently connected, right? And that is the reason why these two haven't actually played a role with each other, along synergistic role with each other, right? But having said that, once you teach them the tools, once you give them the practices, once you tell them how this works, once they are compliant to it for a certain amount of time, once they are able to see the benefits of this on their symptomatology, once they are able to see the benefit of them on their psyche, right, they stick on to it, right? And that itself continues. The biggest advantage we've had is with oncologist support over here, right, at HCG, where at HCG, every patient says, go and meet the yoga therapist, they'll help you out with a few other things, right? And that is enough. From an oncologist perspective, that oncologist word that comes to the patient is enough for the patient to come and seek out help with us.
Yes. So speaking about adherence, so when you talk about spiritual peace or when you talk about yoga and meditation, there's always a religious affiliation which is attached.
Yeah.
Is there an adherence problem with respect to different religions, with respect to yoga and meditation? Or when you spoke about Om, where there's a religious relevance to that, is there an adherence problem with respect to different religions? Because cancer affects every religion. It's a universal disease. So does that, what do you see in your clinical practice?
Chronic inflammation also affects every religion. So that chronic correction also can affect, irrespective of what religion you belong to. Religious connotations are overcome by understanding of what we are trying to do, right? And the understanding that we are trying to plug in awareness. This is the only thing we are trying to do in yoga: plug in awareness and build a positive affirmation. And that we can do, again, I use the word yujjate anena iti yoga in now a different context, where I can use any practice, whatever practice they are inherently used to, is religiously, physically, nutrition wise, all of these practices I can pull in and leverage to help build that awareness, to gain that control over the mind, to reduce the distractions that are there, the anxieties that are there, and build a sense of positive affirmation.
This is very true, but as an extension of that question, do you often see patients coming to you calling out because they feel that this is not religiously appropriate to them?
That apprehension is there at the initial phase, but once they understand what practices we are trying to do, and they understand that this is agnostic to any specific religion, religion as such. You're chanting you're chanting you're chanting Isn't the whole problem comes when you're trying to put it together and call it Om, and trying to put my hands together and pray to some almighty and divine and get some blessings and etc., which is a mechanism, which is a religious mechanism inbuilt for everybody in every religion, right? And we are trying to break that down into its components, to understand how each of these individual components benefit.
Right.
And once they understand that, they are very okay with doing it.
So you don't see that being a setback for following yoga?
Not at all.
That's very interesting.
Interesting. I mean, there's another aspect where the caregivers, like us oncologists, so I'm sure we also go through a lot of stress. There's a lot of emotional connect with the patients as well. So I think rather than just doing yoga practices with patients, I think you just have to also help the doctors get over stress as well. There's a lot of stress aspects. Do you incorporate yoga practices and tell doctors to also practice yoga, or do you have sessions for doctors as well or the nurses as well for yoga?
Provider well-being.
So provider burnout is
Exactly.
a very real situation. And uh, there are published literature that is available to show that actually doing yoga along with the cancer patient is a very nice way of overcoming or extending this burnout. Right, burnout is there. It is a reality of caregivers, but extending the duration or coping with that burnout mechanism is there. We do have programs for caregivers at HCG. We do have programs for nurses, for the doctors, for the relatives of the cancer patients to come and join and do practices for this caregiver stress that is there. We do invite more oncologists to come, despite their busy schedule. I wish they are able to do. However, having said that, specifically for oncologists, they do understand that there is a very big lifestyle element to cancer, because day in and day out they see head and neck cancer patients invariably as a result of some of the habits. They see GI cancer patients invariably as a result of some of the habits. Lung cancer patients invariably as a result of some lifestyle disturbances that are there. So oncologists inherently have a constant reminder to stay healthy.
And in fact, they always say for an oncologist, even a simple throat pain, the first differential diagnosis is to
Is
malignancy. And everything else can be taken care of.
yes.
So, with respect to hospitals incorporating yoga, we as doctors, we are into mainstream medicine, where the alternate form of medicine like yoga or naturopathy is, secondary. But do you get calls from other hospitals to also start off, departments of yoga and integrating yoga into the mainstream medicine? I know one or two hospitals which have started off yoga departments. Like one is HCG and there's another big corporate chain as well. But do you get other hospitals calling you and setting up yoga
Yes.
departments?
So mostly under the either if they have a department of psychology, we usually attach along with the department of psychology, because it's inherently something to do with the mind and trying to address the issues of the mind. So many of the hospitals we have yoga activity as part of the psychology department. We also have standalone yoga departments in several hospitals that are now using yoga as one of the very different modalities. Like how you have MBBS doctors, we have bachelors of naturopathy and yoga medicine doctors who are equally qualified in providing this kind of care to the patients with respect to naturopathy and yoga, and they do get increasingly more number of referrals. In fact, the government has taken tremendous initiatives to put one naturopathy and yoga doctor at every zonal level, at every regional level, in rural areas also, so that they are able to understand what is the requirements. If there is diabetes, you don't really need to do too much about the diabetes. You need to fix your lifestyle.
Yeah.
And fixing the lifestyle controls majority of the diabetes. Only when you have complications, you can send them further on for secondary management. So primary prevention, secondary prevention activities is all taken up by a lot of the yoga fraternity of late.
Excellent.
I think it's been an enlightening session, specifically indigenous, and very proud of introducing something that could be complementary and supplementary to the mainstream cancer therapy.
Thank you so much, Ramrit,
It
for
was a
coming to
pleasure.
our show. It's been really interesting to know about yoga, meditation, and its impact on the cancer patients and also the caregivers as well. Thanks a lot.
And we are very proud of your work, both with respect to the molecular level, what you mentioned, the randomized trials, and the effort that goes into a holistic approach rather than just medicine.
I
Thank you
think
so
it has
much.
been a team effort between a mainstream, and I think HCG has been one of the first few places where truly this has been integrative oncology.
Thank you so
Thank
much.
you so
Thank
much.
you so much.